Hello, this is Sean from WC Physio, and today I want to do a very quick anatomy video about the shoulder. Now here you can see I've got a model of a shoulder just to kind of let you know where everything is in this model. So this is your clavicle or your collarbone. This is your shoulder blade, which sits obviously behind you. And this is the humerus or the bone that's in the upper arm. This joint is a very interesting joint because it is very similar to the hip joint. And the reason is because it's what we call a ball and socket joint. Now there's two fundamental differences between the shoulder and the hip. The hip has a big socket and a small ball, and the socket and the ball fit together nicely. Whereas the shoulder, which unfortunately you can't see in this model, but the ball is really big and the socket is really small. So you can see these don't fit in together. Now there are positives and negatives to having these types of joints. The positive with the hip is it's nice and secure. It will take a lot more force to dislocate a hip than to dislocate a shoulder. However, the hip is limited in movement. Whereas the shoulder, though it is not as strong, we got a lot more movement. So functionally, we can do more with our shoulder than we can do with our hip. And we need that in order to be able to reach for something from a high position, or reach for something from a low position, or scrub our back, or wash our hair if you still got some. But yeah, the shoulder is a very interesting joint because inherently it's not very strong. And that's why the muscles around the joint are very, very important. Because what they do is supply the stability that the shoulder needs during the different types of movements we do on a day-to-day basis. Now the problem lies is when you injure one of those muscles, especially one of the muscles in the rotator cuff. Because what happens is the shoulder then loses its stability. And unfortunately what can happen is the shoulder can move excessively when you're doing your day-to-day activities. And what does that cause? Pain. Normally. Not every time, but commonly. The great news is that with exercise, research has shown that you can treat these conditions using exercise without surgery. Now in some cases surgery will be needed, but in lots of cases it's not. Exercise is key.